The face of HIV/AIDS is more familiar than many think. Neighbors, co-workers, family, and friends. Roughly 100 Kentuckians will die from this still prevalent disease this year. Every day in Kentucky, a new person is infected with HIV. The most devastating part? HIV is entirely preventable. For 25 years, AIDS Volunteers Incorporated has been on the front lines of HIV/AIDS in communities throughout central and eastern Kentucky.
My name is Mark Royce. I'm the Executive Director of AVOL, which stands for AIDS Volunteers Incorporated. And AIDS Volunteers started as a group of volunteers. Early in the AIDS epidemic, a group of friends got together, sat down around a kitchen table and said, we've got to take care of our friends who are getting sick and who are dying. And that's how the organization began 25 years ago this year. HIV/AIDS has impacted Lexington and central and eastern Kentucky in pretty dramatic ways. HIV/AIDS follows poverty.
The first step toward defeating this disease is preventing its spread. As a result, AVOL has made outreach, prevention awareness, and testing a primary focus in an attempt to stop the disease in its tracks.
When I walked in, I could just look at her because she just had this look on her face, and she was like, I sat down and she was like, well, James, your test came back reactive. Okay, I took a deep breath and everything, and I was like, well, okay, what do we do next? And, ever since then, coming in and now being an actual client and stuff like that, it's just like almost going to the dentist. Anytime that I feel down, depressed, or whatever, I'll either call my care coordinator out here, talk to someone. It's an organization that I now have a group of people who are experiencing the same thing that I'm experiencing. They've gone through it. They know they've tried and tested.
Stigma, poverty, and isolation are daunting challenges for AVOL when serving those living with HIV/AIDS in rural areas.
So we're headed to go do testing in a rural area, basically meeting people where they are, meeting the need where it is. A lot of rural communities have high rates because they haven't had access to proper health care. They don't have access to getting into Lexington to do the things that they need to do to keep themselves healthy, so we bring it to them.
Between me and my wife, she had it and I had it, and we neither one of us know. People were just scared to even sit in the chair I just sat in. There's been a couple instances where people just really worked me over with it, and it was scary, and I didn't know why. Most of them think I should report it or pack up and leave. I would rather do the latter. I like this town, but I can't live the rest of my life looking over my shoulder.
AVOL knows that caring for people living with HIV/AIDS means reaching out beyond the walls of a hospital or pharmacy. As a result, AVOL seeks to collaborate with communities to stop the spread of HIV/AIDS and to empower those affected.
If you come back with a reactive test, we can connect you to health care. We can connect you to the services that you need. And for some folks who are positive, they will eventually come back to AVOL for help and assistance with housing, with supportive services, referrals to substance abuse care, mental health care.
That's all my family. This picture right here is me before I got sick. I'm Donna Taryn. I have had HIV for about 20 years. My late husband was Jekyll and Hyde. Before we were married, he was one person. After we were married, he was a totally different person. Unknown to me, he was an IV drug user. And I lived by myself for about 1.5 years, 2 years, and then I went to a nursing home. My doctor got me into a nursing home. He got this place started. My doctor did, and he got me to be the first person in here.
AVOL is unique in that we operate 2 housing facilities. We have a community-based residence called Solomon House. That house houses 7 people who need assisted living. And then we also have a transitional apartment complex, and that helps people move from a state of homelessness through transition into permanent housing.
And they say that no matter what happens, they will be there for us. And I trust that. I believe they will.
Serving 72 counties, AVOL strives tirelessly to provide hope and assistance to those infected and affected by HIV and AIDS in the state of Kentucky.
AVOL's biggest challenge going forward is reaching the people we serve, both in prevention and both with folks living with HIV/AIDS. We need funding to help us reach out into the communities that are not being served right now, whether that be through a mobile testing unit, whether that be from establishing volunteer corps in rural communities. We also need assistance in getting our clients to us, and that could be transportation, that could be gas cards. These are all expenses that aren't grant funded at the moment, and so private money is crucial for us to be able to have this outreach.
They're always there, and they're always will. And that makes me feel a whole lot better about how my future will be later on.
AIDS volunteers collaborating with communities to stop the spread of HIV/AIDS and to empower those infected.
Hello, my name is Melissa Lucas, and for many years I've been a proud supporter and volunteer board member with AIDS Volunteers. The reason I chose to get involved with AIDS Volunteers is very simple. They're working on the front lines right here in our own backyard to combat this life-threatening disease. They work hand in hand with members of our community to provide a compassionate response to those who have been affected and combat this disease. Won't you join me today and others in the community to help AIDS Volunteers do even more? Please consider giving your time and money to this great organization. Thank you.